Good day, friends of Fuzzy. On this broadcast, I'm going to be talking about the different reasons why herd immunity is so complicated. We have people that are saying we're not ever going to be rid of COVID. We have people who are saying that we should go back to normal by the spring. And then we have people who say that maybe by fall we'll have enough people who are immunized to be at a place of full herd immunity. So what I'm going to do is go through the reasons behind what everyone is hypothesizing. So you can understand why there are so many different versions of what people think is going to happen with herd immunity. And then I'm going to tell you where I am this week on what I think is going to happen. Spoiler, I'm actually pretty positive this week. So you may or may not know that I was invited to speak before the Department of Health and Human Services Vaccine Advisory Committee. The reason is because there is a large degree of needle dread and needle fear, which the CDC hypothesized is going to make 7% of our population not get vaccinated against COVID. So I was invited to talk about needle fear and talk about how this implicates the access of herd immunity. How are we going to get there if this many people are afraid of needles? Because honestly, 28% of people say they're afraid of needles. So let's go through what herd immunity is and how it's calculated. And I'll tell you now why I'm actually pretty positive that we're going to get to herd immunity because of a few new pieces of research that have just come out. All right, so going to the presentation. So here's the thing about herd immunity, to break it down. So herd immunity doesn't mean that everybody's vaccinated. It means that there are enough people vaccinated in the herd that the disease quits spreading. There are 330 million people in the US. So now we're saying that we need 70% for immunity. The problem with the statistics that are out there is that 20% of people, when surveyed, said they wouldn't vaccinate no matter what. 17% said they probably wouldn't vaccinate. And the vaccines that we have now, the best ones, Pfizer and Moderna, are 95% effective, but that means 5% will get a vaccine and it's not going to work. So we got to incorporate them. And then the best case scenario, we need to, for those that we need 2 vaccines of, about 40% of Americans don't tend to get their second shot, whether it's hepatitis B or HPV, I mean, cancer-preventing vaccine, whether it's Shingrix. We got about 40% of people who don't get their second vaccine. So I went ahead and rounded up to 15%, saying, probably people are going to be a little, if they're going to get one, they're more likely to get the second one because this is COVID. But that's all speculation. So anyway, if you look at this graph, what you can see is that if we need to get to 70% for herd immunity, given what people say they're going to do and what we expect people to do, that's not going to get there. So let's look at it in a different way. All right, so the herd immunity question is based on what's called the R naught, and this is how transmissible the virus is. How many people are going to catch it? So if the R naught equals 0 or equals 2, that means that for every person who has an active case of COVID-19, they're going to infect on average 2 more people. And then they'll tell 2 people, and it's viral spread, right? So if that is the case, the way you calculate herd immunity is a really simple equation. It's just 1 minus 1 over R naught. So if the R naught is 2, if we're going to spread it to 2 people, then we need 50% of the population mathematically immune so that we're not going to spread it anymore. It doesn't mean they have to be vaccinated. They just need to either be immune or they need it to not spread to somebody else. So that's an important thing. All right, so the reason that people have got their heads in a tizzy is because this B11 version is someplace between 30 and 70% more communicable. So let's say, okay, 50% more communicable. This means that the R naught is 3 now instead of 2. So this would mean that we need to get 67% of the population not vulnerable or immune, and that's why we're talking 70% have to be immune. Again, they don't have to be vaccinated. They have to be immune. So there are a couple things about R naught that are important that we've learned with COVID. When we talk about this number, historically, the disease everybody's talking about is measles, because measles has an insane R naught of like 17 to 18 people. You get somebody in a room with measles and the people in the room aren't vaccinated, boom, 17% or 17 of those humans in the room are going to have measles. It's insanely contagious. One of the interesting things that we've learned through this whole epidemic is how variable the number of the number of people who catch it is. So, for example, in situations where people are wearing masks, the R naught in a community drops down to 0.5 or 0.7. So that's going to end up giving you needing to have 40% of a population that's immune, or 30 to get to a place where you're where we have herd immunity. Weather impacts it. As the weather gets warmer, in one study that looked at a lot of different places in Europe, they found that the effective R naught went from 1.8 down to 1.2. I was looking at the R naught in Georgia, where we are, yesterday, and with the distancing that we have going on, with the masking we have now, the R naught has dropped from a maximum of 1.5 down to someplace in the 0.7 range. So again, this is sort of a flexible thing. So even if the B11 variant is a lot more contagious, we have a lot of good things coming up that are going to lower that percentage and are going to get us to herd immunity faster. So looking at the ways to address, and this is what I was testifying on, the ways to address that needle fear. Buzzy is something that decreases needle fear. This could be enough to get us an extra 19 million covered if we incorporate this. The people that won't get the second vaccine, Chris France did a lot of work looking at what the implications were, and what he found was that the issues of anxiety, pain, and fainting are things that are associated with coming back the second time for a procedure. So looking at it from Chris France's work, that means that, again, we can decrease anxiety about 50%, we can decrease the fainting feelings 100%, and we can decrease pain about 74% in adults. So now we're in a place where, okay, if we make sure that we have Buzzy available for the people who need it, we can get us to a place where we're so close to herd immunity just looking at it that way. But there are other things that are actually more hopeful, and this is where I want to go. One paper that is coming out this week that's on medRxiv supports what we have known for quite some time, which is that children are less likely to transmit the disease and catch the disease. The reason is almost undoubtedly because children don't really develop sinuses until they're about 12 years old, and the entry place for SARS-CoV-2 and the replication of it are in the sinuses, in the nasal cavity. So even though we know that children have a viral load that's the same when you swab them, they're not getting as sick because it's kind of like if you think about a dipstick in a car where you have to check your own oil. This may be so far distant from this generation that it's not going to work. But if you dip the dipstick in, you see how much oil you have. But the actual quantity of oil is going to be dependent on how big your tank is. So in older adults, especially men, their nasal cavities, which is the place where the SARS-CoV-2 vaccine gets sprinkled out and replicates, they're enormous. Children, tiny. So most likely what's happening, since we know that children's immune systems do still respond and they do still have the virus, it's just that they don't have the same capacity to breed a whole lot of replicating virus. So their total viral load is lower, so they're not going to catch it. So one study is looking at children under the age of 12 having about 50% less likelihood of spreading it. So thinking about the population, we need to get to, let's just go ahead and say it's an R naught of 3. Let's say we need to get 66% of people immune, not vaccinated, but immune. So if you look at it that way, children are 48 million people in the US. And so let's say that they have a 50% less chance of transmitting it. Okay, that's like 24 million that we've gotten. Now, the other kind of, I guess it's sort of good news, sort of bad news. We have 27 million people right now in the US who have tested COVID positive, and different people are debating that number's relationship to the reality, given that there are a lot of people who were asymptomatic, never got tested. There are a lot of people who got sick and were like, oh, well, this is COVID, bummer, and never got tested. And if you didn't go to the emergency room or the hospital or your doctor, you just stayed home and were sick, you're not going to hit the radar. So we've got two groups of people, the asymptomatic untested and the sick untested, who have some degree of immunity. The amount of immunity is debated by lots of groups, but let's start just first of all with the number. So one study in San Francisco, which has been, or Seattle, which has been widely mocked, it found that 10 times as many people had COVID antibodies as reported the disease. The problem with that study is that it recruited people from a population with Facebook and newspaper ads that say, do you think you might have had COVID? Let us test you. So your population is going to be heavily skewed to people that want to get tested because they think they might have had COVID. So at the highest possible range, we got 10x. Other studies are finding that about 2 to 4 times as many people as tested positive have antibodies. Now, not everybody has antibodies. Antibodies are lasting about 3 months, but that's okay because even if they last 3 to 8 months, whatever, T cells are the factories that make your antibodies. So long as your T cells know what's going on, even if you're not testing positive for antibodies, we believe pretty strongly that you guys have an immunity. So let's say that 27 million has gotten sick. Now let's make it 25 because it's easier to do math. And given the fact that we're someplace between 2 and 10, I think 4 is a really reasonable number. Certainly by the end of March, we're going to have probably 30 million who have been exposed and tested positive. So I'm going to even say that we probably have 120 million people who are immune. So we've got, if you're counting at home, we've got 24 million kids that we don't need to worry about. We've got 120 million adults who have got some degree of T cell, probably a large degree of T cell antibodies that are good. All right, so now with taking that 144 million off of the 220, so now we only need to get about 80 million vaccinated to get to herd immunity, even assuming that our R naught is at 3. And we have vaccinated 10% of our population at this point. So that's 33 million that we have already vaccinated at least once. But if we say that we're going to have 150 million vaccines in arms by the end of March, and then you need 2 doses, that means that's 75 million. So if you look at the numbers in this way, which I think is very defensible, this would mean we're going to get to herd immunity even if the R naught is 3. We're going to get there by the end of March because we've got 75 million vaccinated. We've got 120 million who are immune because they've got T cells. And then we get 24 million who are kids who can't transmit because they're under the age of 12. And that's conservative. That could actually be 48 million. So all of this is to say, there are a lot of variables. I do believe that, as Johnson & Johnson has said this week, we will probably need to have some booster over time, yearly, like we do with flu. I will also say that masking, because it is still something that keeps you safe, masking is probably going to be with us at least until the end of this year. But from a standpoint of being able to eat inside again, the numbers of cases just plummeting, because that's what happens when you get to herd immunity. The number of cases plummets because you're not replacing each case. They get better, and you've got a third fewer, a third fewer, a third fewer each time. So I'm going to put my money down on reaching effective herd immunity by the end of March. We will know that we're there because the numbers are going to plummet. This does not mean that if you are vulnerable that you shouldn't keep doing something. It does mean that the therapeutics that we know of are going to become a lot more important, because as we start relaxing requirements, we're going to need to be able to still test, because we're going to need to quickly be able to start ivermectin, nasal irrigation if you have not, if you've tested positive and need to flood out the viral load. All of these things are still going to be relevant, but we should be able to go to a place where if we've got good testing, we can party again. So that is my hopeful words for the day. I strongly believe in programs like the Meg Foundation for Pain, which we are partnering with to help patients who are afraid of needles get their protection. Strongly believe in partnering with some of the groups that are at Rainbow Babies and University Health Systems there, who are working to protect the college students who are still going to be at risk, and 68% of whom have needle fear. So even if the population is in a herd immunity state, there are still kids, young adults, anybody that has needle fear that we need to protect, and they need to have some options for that. So we will be helping take care of those guys. It'll be there, but you know what? It's going to be fine. See you guys in April.